welcome to my YouTube channel. Today we are talking about atherosclerosis, aka silent killer. There is arteriosclerosis and there is atherosclerosis. The arteriosclerosis is the hardening of the arteries. For those of us who doesn't know, the arteries are like systemic tubes in the body that transports blood from the heart to the other parts of the body where it is needed. When there is a circulatory disorder, the walls of the artery become thickened, hardened, and loses elasticity. While atherosclerosis, which is our topic for today, is a specific form of arteriosclerosis, and it is caused by build-up of fatty plaques and cholesterol in the walls of the artery, causing narrowing of the artery. Atherosclerosis is a chronic disease. That is to say, it doesn't just happen, it happens over time, and it is unnoticeable until it is almost too late. This fat deposit narrows the arterial walls and makes blood flow through the artery difficult. This can lead to blood clots due to blockage of the arteries. With every narrowing comes a higher risk, and depending on where the blood clot is, complications such as heart attack or stroke can occur. So, let us look at steps in atherosclerosis. The first step is when irritants like LDL cholesterol, toxins like in cigarette smoking finds their way into the artery. This will now cause injury on the endothelium. Endothelium is like a sheet on the inner wall of the artery, which is the intima. So when this injury occurs, the endothelium will become permeable. That's to say, particles can now move through the endothelium into the intima. So injury occurs, inflammation takes place. I have talked about inflammation in one of my videos. So if you have not watched my video on wound healing, please do that at the end of this video. So injury occurs, inflammation takes place. Signal will be sent to the soldiers of the body, which is the immune system. And hey, because something is happening in the body. So the immune system, in order to fight whatever is happening in the body, will now secrete monocytes. Monocytes is like white blood cell to fight whatever is happening. So the white blood cell comes to this area and tries to figure out ways to fight. In order to do so, it now changes to macrophages. Macrophages, like the name implies, macro on phages. Macro is big, phages is eaters. So it's like the monocyte, the white blood cell, now changes to big eaters. Macrophage will start eating up LDL that has gotten into the intima just to protect the intima. If this thing continues, the macrophage at a point, it will become so full that it might even probably die. When it dies, the dead particles is now like foam cell. This foam cell is now what will lead to plaque. And when this plaque continues building up, like this process continues over time, the artery will have more space that has been occupied by the plaques and very small space that will allow blood to flow through it. So that is how the atherosclerosis comes up. It's not just something that happens within hours. Yeah, it takes time. If this process is not handled, and maybe, for example, the artery that supplies blood to the brain is affected, then we have a condition called stroke. That is when brain cell doesn't get enough or no oxygenated blood. If it is the heart artery that is affected, then it will lead to complications like heart attack. Now, let's talk about the causes. What are the causes of this atherosclerosis? The real cause of atherosclerosis is actually unknown, but there are factors that put you on the fence, like predisposing factors, and these can be classified into two categories, like non-modifiable risk factors and modifiable risk factors. The non-modifiable risk factors are factors you and I cannot control. You and I cannot do anything about it. Factors such as age. People from 40 to 60 years are 5 times more at risk to having this. Then gender. Males are more at risk to having this chronic disease. Genetic is also something you and I do not have influence about. Modifiable factors are factors you and I can control. Factors like low physical exercise, factors like high cholesterol level, factors like smoking, factors like diabetes mellitus, factors like hypertension. These are things you and I can actually control. How can we prevent atherosclerosis? We can prevent atherosclerosis if we can identify the risk factors and take care of them. For example, if your risk factor is high cholesterol level, then you can prevent atherosclerosis by reducing your cholesterol intake. If your risk factor is diabetes mellitus, then you can prevent it by reducing your sugar level. How do we diagnose atherosclerosis? To diagnose atherosclerosis, you actually need physical examination. You have to be examined, physically examined by your doctor, and then blood tests has to be carried out in the laboratory, and electrocardiogram has to be carried out to know the state of your heart. So what are the treatments of atherosclerosis? Atherosclerosis can be treated by treating the underlying cause of atherosclerosis. Again, it can be treated by medication like anticoagulants. It can also be treated by operation. Thank you, and I hope you've learned a thing or two. If you like this video, please give me a thumbs up, share, like, comment. Please, please, please. Bye.